of crazy, but I just had to run out of a meeting to get here on time too. So everybody is going a little crazy. I know that, but I need everybody here on time for class, because 1 minute late is actually deducting 15 minutes. So please make sure you're on with your cameras on. Dr. Brown is really on top of attendance. She's watching attendance very closely. So she wants everybody on there. So please make sure, it looks like you guys are all good to go, but first and last names in your name, because it comes up on the Zoom. So we want to make sure that we have it all ready to go. So welcome to week 4. You guys survived the first test. What are our thoughts about the test? Dead silence. That's not good.
I thought the wording was a little like hard to understand. Like it took me a while to like read it and like really comprehend what I was reading.
Okay, good. Thank you for that feedback. Anybody else? I heard that from a couple people. They were concerned about the wording. What I'm going to advise you guys is the way we write the test is the way the HESI and the NCLEX are written. So what I want you to do is use this as a learning opportunity. I know that doesn't help, but I need you guys to be really strong on your test taking so that you guys do well on your NCLEX and your HESI. So the questioning, select all that apply, is always one that people hate. And what I would ask of you is to process of elimination is the best way to answer those select all that apply. We did review the test. There were a couple questions that we gave back to you. Hopefully that's the case. If you want to review the test, I'm happy to go over questions you got wrong with you. And what I want you to do is just contact me and I will, I'll set a time and we'll go over the test question by question on what you got wrong. So if that's helpful for you, please contact me and we will do that. If you got an email asking to meet with me, please do so. We're asking that everybody meet if you were below a 78, but there wasn't too many. So I was proud of you guys. I know it's a hard test, the first one. And the reason for that is we have to get used to the wording. We have to get used to the content. Did anyone find the study guides helpful? Yeah. Okay, good. I'm seeing some shaking of the head, so I'm happy to see that. So what I will tell you is that study guides is going to be your friend for studying for this class. Those study guides are made with the test in front of us. Okay, so we make them and the test correspond so that we can focus content. You guys, we know there's a ton of content on this in our area, and the thing is that there's a lot of overlap. Did anyone feel their med surge coming back to help them at all during the test? No, Abigail saying absolutely not. Okay, well, hopefully you will see an overlap on the next couple tests anyway, because that's how we write our tests so that they, because community, you can use everything. So this week we're going to do home hospice. We're going to review rural health because we did that last a week. As everybody watching the lectures, they're on our announcements on Sundays. So I'm trying to make them short for you guys so that you don't have to sit and listen to me for endless amounts of hours. So I'm just trying to cover main concepts. In our class, we're going to be doing the another case study tonight. We'll be doing a Jamboard together. And what that does is that really, some of the professors are treating it as a quiz. I'm not going to, we're going to learn together. And that's how we're going to do it. But just know I need everybody prepared with their reading and the PowerPoints that I send out by email prior to class. Okay. But you guys did really nicely on your case studies. Good work on those. I had a perfect score on one of the groups, so that was amazing. You guys worked hard and got that all together, so I was proud of you for that. Any questions about the discussion? I know it was like kind of up in the air, like which case study and whatever. And so I had let you guys pick because I thought that's easier for you than me selecting for you, because I just randomly select. So did anybody have a hard time with the group project, or everybody felt comfortable? Good. I'm not hearing anything. Don't forget, we're going to review the first part of this class. We're going to review our infectious disease paper, which is going to be due week 7. That is a group project, and you guys will be rating each other on group work for the whole quarter. So know that that's a good one. And we're also going to look at our vulnerable populations which was last week's content, but we will take a look at that tonight. And we have a project that we're going to do. So let's look at our infectious disease first off. Actually, let me take attendance because I have to do that quickly. Ivana, are you here? No. Camilla. We're light tonight, guys. I don't know where people are. I see that, but I'm going to tell you, Dr. Brown is not going to be happy with light attendance. So I appreciate every single one of you who was here tonight. It's important for us to be here together and to learn, particularly after that first test, just because we now know what we need to focus on a little bit, right? So thank you very much for being here and being here on time. Stephen, I saw you. Welcome. Mary, are you here? Does anybody know something going on in the world that I don't know about?
I know last week I went to the Zoom and the when you're looking at your school and all that, the modules in that list, it says Zoom, and I clicked that link and it took me to a completely different place.
On your announcements?
Non announcements, it's under here, give me a second, I'll look at it.
Okay. Alrighty. So Alvira, are you here? See what I mean? We're really light tonight. It seems strange to me. Okay. Abigail, I saw you. Welcome. Yushana. Okay, welcome. Sandra.
Here.
Okay, welcome. Charity. Hi. Goul, you're here. I saw you. Don is not here. No, Don isn't with us. I don't know why I call him every week. He's not here. Chandra, are you here?
Here.
Okay, Jennifer.
Here.
Mary, make sure you put your last name on. I will tell you that we start class at 4 o'clock on the dot. Dr. Brown, I was telling the class as a whole, we are really being careful on timing. So you guys got to be on camera at 4 o'clock, 6 o'clock your time, or 5 o'clock your time, whatever you guys are. Passion, are you here? You're here. Bridget.
Here.
Jessica.
Here.
You're here. You're contributing. And Lindsay. There you are, Lindsay.
Here.
Okay, Yogash.
Here.
Catherine. Oh, Catherine. I'm telling you guys, what's going on? And Shanice, I saw you.
I'm
somewhere.
here.
Welcome.
Hello.
Alrighty, so what I will tell you is that, guys,
Hello.
it's very important. It's very important for you guys to be here, to be on attendance, to have your first and last name in the Zoom. I know I'm going over this twice, but it's really important, and we are being held accountable for attendance, so everyone needs to be. So it looks like somewhere in the modules.
Did you hear me? Did you hear me, Professor Lonnie? Because
I
it
hear
froze.
Nope,
Okay.
you're good. And I had a rush to go into announcements really quickly. When I
Can
click
you
on
see
my
my
course,
first
you
last
saw-
name, Professor Lonnie? Lonnie?
I only see your first name, so just fix that.
Okay.
All right, guys, give me 1 second because I want to go where Stephen is telling me, because this should not be the case. So I go on home, modules. Stephen, then where do I go after modules?
It's not under modules. When I click courses and I click this class, there's a list that says home, announcements, modules, syllabus, people, grades, vital bookshelf, Zoom. That's where the Zoom link it was.
Oh, see, I have it different than you. Okay, well, we won't worry about it for now, and we're gonna get to class. And thank you for mentioning that to me, though, but we have to make sure we're all here. Okay, so anyway, any questions at all about last week? Test, like I said, was pretty good. You guys, please meet with me if you want to go over questions. So this upcoming week, what we're going to be looking at is we're reviewing week 3 and 4 together tonight. And what I'm going to ask of you is that you follow along with me as we go over our infectious disease project. I asked you guys to get me your infectious disease by Sunday, the 5th. I think that's Sunday. And so what you're going to do as a class, as groups, is just one person send me the email and tell me what infectious disease you want. So you guys figure out whatever you guys want. I'm fine with whatever you want. Okay. And so we're going to take a look here at, let's see, our infectious disease. So let's take a look at our modules. And this is due week 7. Okay. So it's just getting you guys ready. I just want to go over it because I feel like We want to make sure. So this is our group project discussion. Okay, it's going to be a discussion again. Each group's going to pick whatever infectious disease you want. Okay, the list of infectious diseases is found at the National Foundation for Infectious Disease. And then make sure you're including 2 different resources to research. And here's our rubric. We're going to make sure that everyone has this included in the paper. The name of the infectious disease, the cause, infectious disease symptoms, infectious disease mode of transportation, complications, treatment, prevention, how it is tracked and surveilled. That's something you're going to look at the statistical analysis there, and who's most vulnerable. Going to be an APA format. We're going to submit it as if we as an attachment in the Dropbox. Okay, and in the text box, you're going to say the name and the members. Okay, so then you're going to go back and you're going to post. Every single person is posting. Okay, everybody is posting responses to their peers. What I saw a lot of in our reflections or posts to peers was just kind of like, oh yeah, I agree, this looks nice, that kind of thing. Make sure you're using your like data for this, and it's not just like, oh yes, I agree, I read the same thing. Okay, just be careful on those, because I want you to get full credit on that, and that's how sometimes you won't. You're also going to submit this peer review document on week 7, and it's a checklist. If everyone in your group does really well, then you're just going to give everybody a 5. Okay. Any questions about infectious disease?
Is it the same group that we did last time?
Yeah. Mhm. Same group, same everything. Good. So you want to be thinking about that. You guys want to work at it. There's so many parts to it that it's easy to break it up among your groups. You know what I mean? Give everybody a section. Good. Charity, can you try to fix your camera? I keep seeing myself on yours. Yeah, I see. It resets if I turn the camera back on and off. Okay. Well, we won't worry about it. All right, week number 9. You guys have your individual projects, which is going to be our vulnerable population. What you're going to do is you're going to go out in your car. You're going to drive around in your community, and you're going to find a vulnerable population. Give me some examples of a vulnerable population that you guys may have seen in your community.
Homeless.
Homeless people, drug addicts,
Pregnant teens,
low income.
low income. What else do we see?
Pregnancies.
Any of our vulnerable people. So anyone who is compromised for any reason, and we're going to make sure that we see it out of the car. Okay. Then you're going to do some research on that vulnerable population. Why do you think we're doing that in this class?
Because it relates with the healthy people.
Sure does.
Research.
Relates to healthy people 2030. Good. What else is that having us do?
Understanding what the vulnerable population around us looks like.
Exactly. You're getting involved in your own community, right? You're looking and saying, these people are in my community. I can tell you, I live in a suburb of Denver. There is plenty of homeless people that stand on the corners, and I could see them a lot. What I've seen also recently, has anybody else seen this? Families will go stand out by like the supermarket. So you have like a mom and like 2 little tiny babies, and they'll like hold up a sign. And like, I know I've seen that by one of the supermarkets by us.
I have seen it.
Yeah. And what does that make you think when you see that?
I feel like they think if they have their kids with them that you're more apt to like give because you want to help their children
Sure.
not be hungry or whatnot.
Mm-hmm.
I've seen people with dogs by the supermarket.
Mm-hmm. So they bring their dogs too. What else does that make you think of when you see this?
So truthfully, it makes me sad because like we do have a family that like is up by like the corner, you know, like by the grocery store and stuff. And like I've seen them out there with their kids in like the rain. And the kids are just like standing there, and I'm like, oh, like I guess like mom instinct kicks in, but like maybe if they don't have a choice, like what can they do?
Absolutely. And vulnerable populations, what you'll come to see is they don't, they're not choosing that, right? They don't want to be, they don't want to be in the situation they're in. So just remember that. Think about what that impact has on those kids, though. Has anybody looked and thought these kids should be in school? Right? Because I know they sometimes at my lunch, if I run out and get something to eat, they're doing it at 12 o'clock in the afternoon. So she's okay. Thank you for that message. So things to think about when we're looking at these vulnerable populations. What is something we have to be really careful with when we're dealing with vulnerable populations?
I would say
Bias?
not to stereotype them.
Yeah. What do we have to be very aware of?
Our surroundings.
Absolutely. And also, what else? Somebody hit on it a little bit.
Our prejudices.
Yeah. You got to be careful, guys, because when you're handling a vulnerable population, you need to put your biases aside, right? Same like we talked about with religion too, like how if you go into someone's home and just say, I mean, I don't know of a culture that does this, but some will leave the door open. So I know like Jewish people during one of the holidays, they leave the door open and it's left open because someone comes through. It's like part of their tradition. So if you went to somebody's home, I mean, it's quick. They open the door and they say, the guys come in and then goes out or whatever. So just be careful of that. But I want you guys to know that we really have to be our biases aware, those kind of things. It's not something new that I'm telling you. You guys know this, and it's with any group, right? But particularly a vulnerable population. We're going to take a look at tonight, the assignment. Has anyone taken a look at week 9? The only reason I'm going over it tonight is because I want you guys to start working on it. It's a big assignment. It's heavily weighed in this class, and it's an assignment that I need you to work on when you have a free minute. Now, I know in nursing school, you never have a free minute. Trust me, I get it, but you got to find a couple free minutes here and there, right? So let's take a look at what it is. It's actually a very fun assignment. And the reason I say that, I know nothing's fun in nursing school, but let's just pretend if we're going to have something fun, this would definitely be fun, but we're going to take a look at this. And what you're going to do is you're going to research. So you're going to go in the car, you're going to drive around. It's called a windshield survey. And what you're going to do is you're going to find that group. Okay, and we're going to spend some time on vulnerable populations tonight and throughout the rest of the quarter. But here are just some examples from the textbook of people that you could look at. And you're going to, these are people that we could consider for a vulnerable population. You're going to do a PowerPoint presentation. Okay, a maximum of 10 slides. Okay, no more than 10. You can put as much as you want on there. But so you're going to prepare 10 slides. You're going to have an introduction and a citation that is not included in the 10 slides. Okay, so you're going to have like really 12 when you're all done. And then you're going to look at that population and you're going to describe in detail the following: demographics, religion, ethnicity, culture, employment, socioeconomic status, and health and lifestyle behaviors. Okay. So those are 7 things you're going to look at. Now, sometimes you might have some difficulty finding religion on a homeless population. What you can do is do general research and say, I haven't been able to find specific to my community, but as a whole, we see that, I don't even know, whatever religion has a heavier weighted population of homeless in the United States. So if any of these things you can't find to your specific community, you want to do general research. If you're having any difficulty, you'll definitely let me know, okay? And then we have health risks. So we're going to identify health promotion that needs to be done, and health risks. We're going to look at our resources. So we're going to look at what do we have in the community. Great place to go for this is your state Department of Health. They love to talk to nurses. They have tons on their websites. And they love to help with this kind of research. So you're gonna do resources that you have there, programs you have, and services. Then you're going to identify services that they don't have that you're going to come up with through research based on your vulnerable population. You're going to have a primary, secondary, and tertiary intervention, okay, of something that's not available, but you're going to find. And then you're going to summarize research plans. to address health promotion and health risks. Here are really helpful hints. It's on here. Your National Center for Health Statistics, Census Bureau, Healthy People 2030, data and statistics about the US, and US Department of Health and Human Services. Okay. Any questions on that? That is an individual project. You guys will let me know your vulnerable population if you want to. You don't have to, but I can help guide you a little bit if that's helpful. Any questions on that? No, you guys are silent tonight. Okay, so what we're gonna do now is we've gone over our two big assignments that I want you guys to be working on. So next what we're gonna do is we are going to do a Jamboard. I'm gonna split you guys up. I've given you guys several questions out of our reading, and I want you guys to answer them. And if you're having any difficulty, where do you think you're gonna look? Are you gonna
PowerPoint.
Google? Yeah, PowerPoint's a good one. Are you gonna Google the answers? Jen saying no. She's right. No. What are we doing? Where are we looking?
Textbook.
Yippers. Everybody has a textbook, and these answers are straight out of your reading for this week. Okay. So let's take a look at our Jamboard. I want everybody to join in. And if you can't join, you know how it goes. Don't worry. I'm going to put our link in the chat. We're all going to hop on there. Let's do this. All right, and I'll pop in like I always do, but this is just a way. Now, like I said, this is something that some of the professors are doing as a quiz type thing, but I'm going to just make sure that we do it. We're going to do it together as a group so that we get that content down. Okay. All right. Any questions on what we're doing? So there's 7 slides. You may only have like 3 people per slide. Okay. And that'll make it easier. So everybody on our Jamboard. Okay. We're all joining. I see. So let's take a look at our questions that we're going to go over as a group. We're going to do, oopsie. What are pros and cons of rural nursing? What are some concerns we have with women and children in these rural areas? It's going to be one group. Next group's going to be what are some barriers and what are some nursing interventions that we can do as community nurses to help? Our migrant workers, big topic that we're going to cover. What are they exposed to? And what do we do with our different prevention levels? Medicaid and Medicare. What are the two? How are they reimbursed? And what's the effects of homelessness on health? We're going to look at qualities that a parish nurse needs in order to care for their community. What kind of things are we going to use with med-surg and mother-baby knowledge in these areas? So give me some scenarios. Oh, I didn't do a 6. So we're only doing 6 groups. And 7, how are home health nurses and hospice nurses alike and how are they different? Okay, so we're going to do those all as a group. So 6 groups we're going to do together. I'm going to randomly assign you. So I'll come and join you guys. If anybody has trouble, let me know. Okay, here we go. Group 1, I'll do slide 1, 2, slide 2. Group 6, we'll do slide 7. Okay. Charity, I need you to join into your group. Your camera's off as well. So if I don't have you join on, I'll give you just a minute, but if you don't join on, then I have to put you in the waiting room and you will not get credit for tonight's class. So we have to be really careful about this.
Recorded.
How did I end up in here with you?
She's ending all the groups. Hi,
I'm
Bridget.
ending
Oh,
all
so we
the
just came
groups.
back early. Okay.
All right, I'm going to have everybody come back together and then we're gonna take a 5-minute break and then we'll meet back up, okay, and we'll go over our stuff, but I need everybody to join back together. Join back together slowly but surely. And we'll take a 5-minute break. The reason I'm doing 5 minute, well, we could do 10. Let's do 8. Let's come back at 5, 6, or 7, whatever's your time, okay? You guys, keep the cameras on. But you can mute yourself because I don't want the Zoom to get all weird on us. So let's just make sure we're all back together. Is everybody back? Oh, no, hold on. All right, so we are taking a break. It's 4:53 my time, 5:53 or 6:53 your time. We're going to come back together at 5, 6, or 7. So 7 minutes, we're going to take a break. Please leave your cameras on just so that the Zoom thing doesn't get all weird. I don't know what it does during break time, okay? So let's just keep our cameras on. You guys mute yourselves and enjoy for 7. Alrighty, we're all back. Thank you. On time. Great. All right, let's take a look at our Google Jam, our Jam board, and see what we came up with. Everybody did a really good job on that. And let's see here. Alrighty, we are going to take a look at our first topic, which is rural healthcare. And we take a look at pros and cons of rural nursing. What are some things we want to talk about?
Some of the pros were everyone kind of knows each other, so you get a close relationship with the doctors and nurses and the clients. They have access to midwives, which has decreased the number of stillbirths and infant death rate. Doctors get to learn, so do nurses, how to best adapt to their clients in order to help them out. Good word of mouth. If one person likes the doctor or the nurse, they might tell their friend, who maybe their friend was a person not going, so they didn't know if they like the person. That could bring them in to get care. Some of the cons, you got more of an isolated community like the Amish, perhaps. Living in a wider set area, so there's trouble with transportation, more chronic illnesses. You got higher rates of elderly as opposed to the cities, higher blood pressure, obesity, smoking. You got poverty, educational, there's not much education as much as you would find in a city populace.
Good. You guys covered quite a bit. So think about with our women and children, what is something we talked about as well? Everybody knows everybody in a rural community. What's that going to do to our women and children? A topic that we talked about a little bit was abuse, right? You're not going to see reporting of abuse. You're not going to be seeing reporting of mental health. You're not going to see reporting of these things because everybody thinks everybody knows everybody. If you guys watch that little video in the lecture, the guy said that they had closed the hospital, and so they had to travel very far if you're having a heart attack. Well, something to think about. Why do we think they have more chronic illnesses? Anybody can answer.
They don't have access to basically a healthcare facility nearby, so less compliance with follow-ups and things like that.
Good. What kind of prevention are they going to have less of?
Education.
Yes, and what else?
Immunizations, screenings.
Yep. Your screenings are going to be much lower because they're going when they're really sick, right? They may not have. But I don't know if anybody has watched that show. I stopped watching it, but there was a show on, and I forget what it was called right now, but I'll remember in a second, where there was a nurse. She was hired as a midwife to help the doctor, and he was the only doctor in the whole community. It's on Netflix.
Virgin River.
There you go. Virgin River. I stopped watching it because I thought it got a little weird. But anyway, Virgin River, if you've ever seen that show, that's a great example of rural nursing and rural healthcare. And if you remember in some of those episodes, you would see. Now, be careful with shows because they won't always depict it accurately. And of course, she falls in love with, the cutest guy in the whole town. That's like the show part of it, the entertainment part of it. But she's really held responsible for a lot, and it's all on her. So that's really a con sometimes of rural nursing. You're very independent and you're on your own. So something to think about when we look at this community. Some other things we want to look at, which they talked about, is our prenatal care is not going to be nearly as good. So what is going to happen with our women and children? What are you going to have if you don't have good prenatal care?
Mortality rates are going to go up.
Yeah. You're going to have worse outcomes on our babies and our moms. Word of mouth is a big thing with them. Please remember that you're not going to have reporting like you would necessarily in a more urban area. Okay, we take a look then. What are some barriers to healthcare in these areas, and what are some things that we can do?
Well, they don't have technology.
Well,
Like
we
some of
don't say
them,
they don't.
well, you know what I
I
some of them might not have a computer. They probably have a
Good.
phone, but they don't maybe necessarily have a computer,
Mhm.
and they have to
Think
travel
about that
longer.
Just stop
Yeah.
for 1 second. Why do you think that technology is also going to be a problem? Not only do they not have a computer, but what else is hard to get?
Internet
Your-
service.
Yeah, Wi-Fi, right? The Wi-Fi is not gonna be very good. Okay, good. Keep going.
They have to travel long distance to get the health services, so they're less likely to go.
And what do we know about travel in rural areas?
Transportation can be hard. Like,
Mm.
you probably don't have like the normal buses and.
Good. Yep. You don't have that public transportation like you would in an urban area. Excellent. Keep going.
Unpredictable work hours or unemployment. Like if you're like a farmer, you have long work days.
Mhm.
Small communities, everybody knows everybody's business.
That's a big one. Yep.
So we did some nursing interventions would be like telehealth.
Mhm.
Nurses create clinics in the area to be able to do like screenings, vaccines, things like that. That's where we did like the free healthcare clinic screening days, where you like bring a bus in, come in, do like blood tests, EKGs, the x-rays, all that.
Good.
Um,
Telehealth, where could we use that? Primary, secondary, or tertiary?
Would be primary, right? No.
Well, tell me what you're thinking. Anyone can help her out. She doesn't have to do this all alone. What will we do with primary and telehealth?
It's educational. Like
Mhm.
you're educating the patients on being able to communicate with your provider.
And we're educating on what other kinds of things will we educate on? Think about our availability to supermarkets in a rural area. Yeah. You're gonna focus on nutrition. We know obesity is a #1 concern with our kids. In a rural area, they may not be getting access to all the variety that we have in urban areas, right? So we can teach about obesity. What else can we teach about?
The importance of immunizations.
Of course, immunizations, we always like those.
Smoking cessation.
Good, smoking. And how can we use telehealth as a secondary?
Screening.
Kinds of
For
screening
individual-
are we doing over telehealth?
So individuals, I'm trying to think.
Questionnaires.
What kind of questionnaires?
People that may be on pre-diabetes.
Sure, we could do those. What else?
Or like mental health screenings.
Good, 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 Jessica. Mental health is a huge problem in rural healthcare because they don't want to get help necessarily, or don't know that they can get help, or don't want the neighbor knowing that they're getting help. So good. Mental health screenings, what other kind of screenings are we going to do? Obesity, tobacco, what other major ones?
Like
Diabetes.
diabetes risk.
Hypertension.
How are we going to screen for hypertension in a secondary prevention?
Their diet. Or stress level. Or
What's a big one with hypertension? What do we know it's connected to?
headaches.
Headaches, yeah. How about genetics, right? Don't we know that hypertension is a genetically driven? Diabetes is oftentimes type 2. Even type 1, they see a genetic component with that. So yes, very good. We're going to do those kind of things. And telehealth we can always do as a tertiary, because has anyone done telehealth?
Yep.
Yep, good. And so who always called?
It was usually like who always called like to talk to me.
Mhm.
Usually the nurse practitioner.
Oh, okay. So, but why most times are we looking for telehealth? Well, are we sick or we're healthy? And we're just
Oh,
feeling like
sick.
talking to
We're
you're going to
sick.
be at that tertiary level, you're not just going to call to, chit chat with the nurse practitioner. I don't think nobody's going to do that necessarily.
So they did them with my daughter for like med checks also.
Oh,
Like
good.
telehealth visits for like med checks.
Yeah. Good. All right. So these are kind of interventions we can do. We can do them on all levels. I want you to know that our barriers, like we talked about, technology, our work, our transportation, all that kind of stuff. I have one little I'm going to show you guys one little PowerPoint that I want to have you guys look at that just goes over real quickly. That's my Medicare and Medicaid. Hold on. When we took a look at our health risks, less likely to do things in their free time. They've decreased compliancy, sometimes with like seatbelts. Our rural health screenings, we're going to be decreased chronic illness, more prevalent. Know that there is a reporting health issues is a problem. So we talk about sex abuse, we talk about drug abuse, and mental health is super, super duper important. Okay, all righty. Let's go back to our Jamboard, and we're going to take a look at slide number 3 and our migrant workers. What do we know about them?
They're at, or they get exposed to a lot of pesticides, as well as higher risk for musculoskeletal injuries. Exposure obviously to pesticides comes from the farm workers using the pesticides for their crops and products. A primary intervention for that, we put down being able to, let's see, teach not the farmers basically to reduce their exposure to the pesticide. We also read in the book that a lot of the times they're either not getting taught about the risk of being exposed, or they don't understand. So making sure that they're not only just being taught, but taught at a level that they understand as well as in their primary language. Yes, they're also exposed to musculoskeletal injuries because of constant bending and repetitive motion, standing for long hours. Secondary prevention, we put down screening to show pesticides levels. And then for tertiary, we put down initiate treatment for pesticide exposure and treating things like nausea, vomiting, skin irritation, and any musculoskeletal injuries that they have.
Good. And there's one, there was one other thing you guys touched on here, which I liked as well, your prolonged sun exposure. Think about how often they're in the sun. They're in the sun all the time. What are we going to be screening for with them?
Skin
Dehydration.
cancer.
Yeah. Skin integrity, right? Making sure our musculoskeletal is going to be a big concern of ours as well as the pesticides. So the thing with the pesticides, be careful because there's not a whole lot that you can do if they're exposed already, right? Because then we're already at a tertiary level, we're already treating. So we want to go back and we want to teach everyone before they're exposed, okay? And about the side effects and then about the things they can do. So if we take a look real quickly, I have just to emphasize in some of these points, I want to take a look at our pesticides. Oopsie. And we take a look and we see that our pesticides, hey now, what we're going to look like for our screenings, which you guys put in yours, which I'm very happy with, your urine testing, where those are going to be our secondary hand washing stations and conducting screenings. Preventing exposure, we're going to provide education. And then with our tertiary, we're going to treat. And so you guys hit on everything and that's straight out of the book. So good work. Any other questions about our migrant workers? Just think about what they're exposed to all the time. It's not fun. And they don't want to be exposed, right? Who would want to be exposed to something like that? But as long as we're doing our part as a nurse and teaching them, then that's a good thing. Okay, we're going to take a look at our next one, which is Medicaid and Medicare. Big, big topic here. I do want you guys to know this. Okay, team. Tell me something about Medicare from this group.
One second.
No worries. Remember the 2 words I told you was the trick. So when we're looking at, I'll help them out. Medicaid and Medicare, there's 2 words in there. There's care and there's aid. So Gould, tell us, who are we going to care for?
So Medicare is for mostly the elderly over the age of 65. Medicaid is for people that don't have income or limited resources to healthcare.
Good. What else can you tell me? Who's federally funded?
Medicaid is funded by the state, but it's jointly, I mean, it's funded jointly with federal and state, but it's ran by the state.
Good.
Then Medicare is federally ran and funded.
Okay, funded. So what I want you guys to remember is the difference you're gonna see is federal and state funding there. So they are both federally funded. But what I will tell you is that Medicaid goes by different names based on the state you live in. That's the easiest way to remember who's got the state part of it, right? And so in Colorado for children, it's CHP. What is Medicaid, Ghoul, you said in Tennessee?
TennCare.
TennCare. Okay.
And I found out for you, Professor Lonnie, and I put it in there, it's Famous Plus for
what's it called?
children. It's Famous Plus
There you
for
go.
children up to 19.
Very good. See, so we learned all our different names of our Medicaids. Okay, you guys have a lot on here, federally funded through the Medicare, who it's funded for, the Center for Medicaid and Medicare Services. We know that this is an organization that is run and it helps with our coordination of care with them. Reimbursements from our payments from Medicare to hospitals and physicians. We talked a little bit about if your Medicare does not cover you, what can you possibly qualify under?
Like secondary. Insurance,
Or
like
what other one?
Probably Medicaid, because you can have Medicare and Medicaid.
Mhm. If Medicare is not able to cover and you don't make enough income, which a
Medicaid.
lot of people over 65 don't make a lot of income if they haven't, right? If they don't have a job and they don't have money saved, they're going to qualify. So it really depends on the
Medicaid.
diagnosis there. Generally speaking, I want you to know 65 and older is going to be our Medicare community, but they can certainly qualify for both. Secondary insurance, we talked about a little bit, how we could do some primary prevention. How are we going to do that with our secondary insurance? Somebody help Ghoul out. He's answered all the questions.
I answered some too. Where did Mary go?
Mary's somewhere.
Mary's
Right,
here. I'm
Mary?
listening.
I know it's hard sometimes, people don't like to speak loudly. Okay, but what do we know about our secondary insurance? When are we going to educate our people on that? When they're 65 and retired?
No, in their 40s.
Yeah, 40s or 50s, so that they can invest and do some research on it. Okay, homeless. What's our effects of homeless on health? Mary or Shanice, you guys fill us in.
All right.
They
Go ahead,
cannot
Mary.
afford I'm talking. They financially can't afford insurance. So they would be mainly seen at the emergency departments, especially during the winter. Homelessness increase. Well, people who are homeless go to the hospital more often, just to get warm air, or if there's actually something going on. And it also puts a strain on the healthcare system as a whole, as well as the nurses that's providing the care to them, because you also have to worry about nursing priorities, in their
Right,
job.
and what did we say about homeless community? It plays a part on nursing priorities, but what else does it play a part on?
Cost effectiveness of care.
Yeah, we're spending a lot of money, right? Or providing services and not being reimbursed as a hospital, so things to think about. But does that mean, what could we do as a community nurse?
Make referrals to places that would be able to provide them care that they would not have to pay for.
And
Another,
maybe free, somebody spoke about free health clinics. That may not be
I
an
said
option,
that.
but we certainly do have community-run shelters where they can go for warmth. We're making sure we're teaching them about that. We're making sure we're teaching them to follow up with care as much as they can, right?
I know where I live. We have 'cause I used to work for one. We have things that are called community service boards, and they are in various regions throughout Virginia. And they provide, actually, a lot of them provide care that are for individuals that have psychiatric, but also they will also refer, there's some that have their own private primary healthcare providers, but then some of them also can see doctors that are also through these community service boards because depending on the type of programs that community service boards offer.
Good. And what do we see among our homeless communities? What do you think they're using oftentimes?
Drugs
IV drug uses.
or alcohol.
So think about our chapter last week on drugs, alcohol, and tobacco and how that impacts our homeless population. What are they going to be more vulnerable for?
Like AIDS, Hep C.
Since-
What else do we know? Sometimes we're gonna also see something among our homeless community, and that's gonna be our mental health concerns, right? They may be put on medication. They probably won't follow through if they're not able to, right? If they can't afford it. So you may see them come into the ER with mental health crisis because they need to be on medication that they're not being treated for. Good. And parish nursing, what a great area. Is there anybody here who knows a parish nurse? I can't see everybody shaking. Say yes if you do. Anybody know a parish nurse? No. It's not an area that we know a lot about in the sense of it's not commonplace to see them. But what parish nurses do is they address spiritual, mental, and physical health. So what are some qualities that a parish nurse would need? Who's in this group?
I think this is the group I was in with Charity, and she came
Okay.
back in and kind of filled it out, but I wasn't
Okay.
on it.
Okay, so tell me a little bit about, oh, so nobody really answered this. Is that what you're telling me?
Yeah, Charity did, but then she dropped, so.
Yeah, okay. All right, so we're gonna go to group 7. We'll go back to parish nursing in a minute. And home health and hospice nurses. I'm going to show you a quick video. We're gonna watch this. And it's going to be on home health and hospice nursing. And what I think we have in this group is probably a lot of our hospice and home health people. So hold on. Okay, just watch this real quickly. Can everybody see the video? Yes? Okay. Oops.
And no pain to your back anymore? You haven't been having to take your pain medicine?
No. There's no time limit when she's here, and she always makes sure that I'm comfortable and not in pain.
I guess I had my first hospice patient at my first nursing job. I really seemed to help that patient and their family. When the patient passed and the family came up to me and hugged me, crying, saying thank you so much, you don't really get a lot of that in nursing. I was kind of drawn to hospice from the very beginning. So a home hospice nurse goes into the home and assesses the patient and assesses the family to see what kind of needs, whether it's medical, emotional, any outside support that's needed.
That's cute.
Oh, that's cute. If you can help somebody in their very last hours, days, months, that's kind of the best gift you can give for somebody and their family as well.
I always make Bella meditate.
I enjoy all the relationships I build with this job. I feel like I really get close to all my patients and their family members. My favorite part of the job is all the people I get to meet. And my favorite part of the job is when somebody passes and they're comfortable and their family is okay with it and their family is comfortable, because that's a hard thing to do.
Aww, they ate everything.
As a hospice nurse, I have seen and heard a lot of things that have changed my spirituality and make me feel like there's always somebody there waiting for you. I always had hospice in the back of my mind ever since my first hospice patient. And since my first day, my first patient, it's just been, this is where I belong.
That's good.
My name is Sarah Turner, and I'm
Okay, so I wanted to show you that just briefly because hospice nursing is an area that we, is for some and not for all. How many of us have worked in hospice?
I have.
Right, so we have like 4 of us. Okay. What we need to know about hospice is we need to be comfortable with death and dying, correct? Because hospice is when we're going to see this. I can tell you, and I will admit this fully, that's not a topic I'm particularly comfortable with. So I would not work in hospice. But what I want you guys to think about when you're looking at your career is what are you going to feel comfortable doing? And if you're not comfortable in that arena, then that's probably not something you would want to focus on, right? So with home and hospice nursing, let's take a look at our Jamboard and see what did our group come up with, which you guys did a good job on it. I just have to get out of my video here. Okay, now. Just hold on. Okay, when we take a look at, oopsie, we take a look at our home and hospice, where is our? Now, sorry guys, I don't know why I can't share right now. Nope. Where'd my page go? Home and hospice health, how are they alike? How are they different? Share that with us, please. Without our Google Jam while I'm trying to share it with you guys. Tell me about it. What can you guys tell me?
So we put up that they're both the same, but by providing care within the home, such as like bathing, changing, wound care, medication, stuff like that. But they're also different in home health does like promotional health care, whereas like the education of medication or disease management or something like that. Whereas hospice care is usually like comfort care to help like families and the patient be comfortable in like their last bit of life.
Good. What's something that you see among hospice and home health? Starts
Are
with
you
a
looking
C.
like involving family members for like
Mm.
caregivers?
Keep going. We talked a little bit about this.
You mean comfort?
No, not comfort. It was in your book. What's the word for it? Collaboration, remember?
Oh, between the
Right.
physicians, the nurses,
Yep.
caregivers,
Yep.
everybody
We
has
need-
to be on the same page.
Very good. We need to coordinate that care, right? Whether you're home or hospice, because why? Who's the one who's there? Who's going to see everything? The nurse is going to see everything,
Yeah.
right? So what kind of coordination we'll have is physical therapy, occupational therapy, speech, mental health, priest, a minister, all kinds
Social
of
worker.
things. Social worker, very good. And what we talked about also is sometimes families are in different phases. So if you're in home health care, you may have a family that's in family crisis. And in hospice, you may have somebody in family crisis, and sometimes they're not. They're just happy to have somebody in the home and somebody to help them deal with the patient at hand. So we women want to make sure that we're supervising our home health aides, right? Because I'm guessing those who worked in healthcare were working as LPNs, yes?
Yep.
Yeah. So LPNs oftentimes will be those home health aides, and we want to make sure we're checking our tests, documenting, because nobody sees what you're doing except the patient and the family. We talked just a little bit about how families sometimes will not see what the nurse is doing, and we can't really rely on them anyway if we haven't charted it, right? If we haven't charted it, it
It
hasn't been
didn't
done,
happen.
right? What are some primary prevention things that we could do in a home health nurse job?
Like primary prevention. You could do like diet education. I don't want to say medication education because then that would be dietary.
We're not gonna do med. What else are we gonna teach them about? They're compromised because they're getting home health aid. They're getting home health care. So what else are they vulnerable for?
Also like the risk of like diabetes, heart disease.
Yeah, our basics, our
Obesity.
flus,
Yeah.
our COVIDs, all those. So what are we gonna be teaching them about?
You can
Hand washing.
them about if their home health, like prevention of falls, things like that, like risk for falls, setting up rails in the shower, good lighting, things like that.
Okay, we may not be putting those things in the shower though, unless they have already had some
Fallen.
compromise. Right? But we are going to be making sure they're getting their vaccines. We're going to make sure that they can get to the vaccine appointments, right? Convenient locations, stuff like that. How about our secondary?
So just screenings like their blood pressure, draw labs in home.
Good. Where can medication come into where can we look for screening on medication?
Looking.
How can
Looking
we
for
screen for medication, anything about medication in the secondary?
Toxicity, like levels, like if they're taking DIG or if they're taking lithium, any of the medications, like their levels.
That's going to be more treating if we're drawing their levels. What are we going to do?
Side effects.
Polypharmacy.
Yeah, you're going to take a look at the side effects, right?
Yeah.
And we're screening, are they having side effects, right? So that's where a secondary can come in with medication. And I bring that up because Jessica brought up medication sometimes just as tertiary. We can certainly screen and see if we're having any side effects or are they feeling off? And we don't know why they're feeling off, but could it be a medication side effect? For sure. So we screen there. What are we going to do tertiary?
Instructions for dietary modifications, insulin injections.
What other kind of things are we going to be looking for? You, Shonda, you spoke about it a little bit.
Like the safety stuff in home. It's like removing clutter, adding handrails, lighting.
Yeah, but we're going to look more for things like infections that are developing, right?
Yeah.
Signs of infections. It's really important on our older population, right? And what other things are we going to look at for our older population? What are we going to make sure we are promoting?
Like nutrition, making sure they're able to eat adequate meals.
Yeah, eating, that the food's good, but this is all going to be probably secondary when we're screening what they're eating.
Yeah.
But on our tertiary level, what we're going to be looking for is are they providing their own self-care? Because what do we worry about with our older clients?
Skin integrity.
We worry about skin integrity. What's something else we worry about that starts with an A and ends with an E? Your son comes in and says, hey, let me take your checkbook. What's that called?
Oh, abuse.
Abuse, elderly abuse.
Yeah, it's a big one. So we want to promote that self-care for them, right? Whatever they're treating, they're doing it themselves, okay? We don't want to hand it off to the daughter and say, here, you take care, because what does that do to that older patient? It tells them they're not capable, right? All right, so that takes us to, we have 5 minutes left in class. I'm going to do a little Kahoot with you, like maybe 2 questions, 3 questions. We'll do a little bit, okay? I can send it to you guys if you want, and it'll just be a review of week 4. Any questions at all on our home health, on our hospice, on our rural care? What our homeless do, they go to the ER. We know that. Anything else? What is the thing we use if we're screening for drug, alcohol, tobacco use? Does anybody remember what that's called from last week? Somebody
Like
spoke about it.
Like the withdrawal symptoms?
No, because that means they're already addicted. What if we're screening for it? What would we use? How about a behavioral health? Right, a behavior health survey. So we see what tendencies do they have? Are they falling into that category? Okay. So, all right, we're going to take a look at a Kahoot real quickly. Let me pull it up, but you know, I've been having a hard time tonight. So let's see if I can actually do this. Yes. All righty. We're going to go to Kahoot and we're going to do some Kahoots. It'll be a nice review for us of what we've gone over. Here we go. Here comes our pin. 967-9965.
967.
9965. All right, you guys ready? Here we go. The official parish nurse for Sisters of Mercy is retiring. This other nurse is interested in applying. What does she need to do? I didn't talk a lot about parish nursing. We will go back to that, but. Yeah, I knew we were going to be split here. The correct answer is evidence of a mature faith. Why is that? Why is green the right answer? What do we know about parish nursing? Nothing? I hope so. Remember, guys, on parish nursing, you guys have to be aware of your own biases and aware of your own faith. And so when you go in, the faith does not need to match the community that you're serving at all. So you will not need to convert to anything. That would never be the case for a nurse. You probably want some experience, but there is no definite line in the sand that you need 1 year med-surg experience. What you do want is some experience probably before you do this, only so you have a basis. But I can tell you, even in school nursing, it's good to have some experience, and there's brand new nurses that start every day. So it's not a requirement. Our biggest thing with parish nursing is you need to know where your biases are and what you believe as opposed to everyone else. But we were kind of split on that one, and I figured we would. In conducting a home visit with a new client, what problem should the hospice nurse address first? I need help with ADLs. I'm most concerned about being alone. Can you tell me about my bowel and bladder problems? And I'm having difficulty with food. Okay, so nobody picked the correct answer. And I'm most concerned about being alone at night. What happens if somebody is concerned about being alone at night? What is that going to tell you about them? What are they not doing?
I'm not sleeping.
They're not sleeping. What do we know that people in home and hospice need? They need their rest, right? Needing help with ADLs. What do we know about ADLs? Do we need to be a nurse to take care of that?
No. It's occupational therapy.
Not even. Who can
Home
help
health
with
aides.
ADLs?
Home health aides.
Yep.
Anyone.
Yep.
Family.
What I want you to remember with Medicaid and Medicare is Medicare will not refund for anything that is not a skilled nursing activity. So if they say they can't get dressed, Medicare is not gonna pay for somebody to go take a look at it. Okay. So can you tell me my bowel and bladder problems, and I'm having difficulty with grief? I think difficulty with grief, I could understand if we're doing a mental health assessment, but we're looking at priorities here. So we know they're not taking care of themselves at night. All right, number 3. We'll skip this one. I don't like this one. During a home visit, the RN delivers the flu vaccine in early September. What level of prevention are we doing? Very good. I'm so proud of you guys. Yes, it is primary because we're doing our vaccines, our vaccinations. Okay, that takes us to 5:40, so I'm going to stop there. I will share the Kahoot with you guys. Let me do that right now in the chat if you want it. And what I will tell you is we are short people tonight. Wow. Let me take attendance real quickly. I got to do it because I'm going to have my Zoom and I have to make sure that all's here who says she's not here. She's not here. Steven, you here? Yeah, you're there. Mary, you here? No, Mary's not here. She's off camera. Alvera, you're here. Abigail?
Here.
Yushana?
Here.
Chandra?
Here.
Charity? She's gone. Cool.
Howdy.
You're here. Thank you. Chandra?
I'm here.
Jen?
Here.
Passion?
Here.
Bridget?
Here.
Jessica?
Here.
Lindsay?
Here.
Yogash?
Here.
Catherine, no, and Shanice, you're here, right?
I'm
I
here.
don't know why it looks so, thank you, guys. Okay, I just have to do that because I'm gonna have to respond to where our people were. Okay, any questions for what's due this week? Let's look really quickly and then we'll go, okay? I promise, I promise. So here we take a look at our modules. Where are we? We're in week 4. Oops. So all we have this week is gonna be our HESI case study. You click on it, it will grade it, it'll put it in the grade book. I don't even touch it. So what this tells me for week 4 is what do we have plenty of time to work on?
The individual vulnerable population that you want to start
Reading.
working on now and studying for week 4 for exam. Or week 6.
Week 6, you're gonna
6 for our
study, you're
exam.
gonna read. There's no excuse for not reading, right? Okay, guys, good night. Have a good week. Stay safe. Please let me know if you need anything and I'll see you guys next Tuesday.
I had to talk
Thanks,
to you.
Professor Lottie.
Yep,
I'll
yep,
email
I know,
you about my
Abigail.
questions.
Okay.
Bonnie,
Did-
were you going to send out that cahoots or did you already?
Oh, geez. So sorry. I told you I would and then I didn't. Oh, here it is. Hold on one sec. I'll get it.
Are you gonna post that in the announcement?
Yeah, that might be better.
Yeah, post an announcement. That'd be great.
Okay. I'll post in the announcement.
Thank you so much.
Thanks, Professor Lottie. Have a
Okay,
good
bye.
night.
Good night.
Professor Ronnie, can I wait for you whenever you're done?
Yep, just give me a second. I'm just adding it to the announcement so I don't forget. All right, Abigail, we're gonna go in a private room, okay? I will come back for, well, Mary's gone. I don't know where she is, but, I'll come back for Alvera. Let's just go to a breakout room. Abigail, you're still in room 3 somehow. How is that possible?
I'm not sure.
All right, don't worry about it. You see your room 1?
Yeah.
Okay, I'll be there in a second.
Are you still on Zoom?
Yeah, I'm waiting to talk to her, and I think you should wait too because you were off camera when she was taking attendance.
Oh, okay.
Stay. I mean, I would.
Hi there. Bye, Abigail. She's leaving. Okay. Hi there.
Hey, sorry. Okay, so first I wanted to apologize about being late. Should I email you and Dr. Brown regarding?
You can, I don't know where that's gonna go, I'll be honest with you. It's very, we as faculty are being very diligent about it as Dr. Brown wishes it to be. So, you could send an email. I don't see anything wrong with that, but I will have to tell her that yeah, she can watch the recording, of course, and she may or whatever, but we just got to be really careful because the attendance policy, it's an audit thing. I don't know how else to explain it, but it has to be done. It has to be done legit. So it's got to be in one location. And the mindset that I want you to have is this, and this is how I explain it to students, is that if you were sitting in a class, you couldn't be picking up your car. Right? Like you couldn't. So you just have to put the bulk of time in the hour and 40 minutes and don't get your car during that time, or you know what I mean? Or don't pick the kids up, or I don't even know if you have kids, but you know what I'm saying? You got to be really diligent about what you're doing during that hour and 40 minutes. I know this is the first quarter that we're being pretty diligent about it. So, you know, she may have some flexibility. I can't speak on her behalf though.
Okay, I just didn't want her to to think that I just didn't feel like it. Like it was like a special circumstances. Not that it's excusable, but I just the whole mindset of me just not caring about classes. I just don't want you to think.
Yeah, no. I mean, I honestly, just trust me. I don't have any preconceived notions of anyone. I don't know anybody well enough. But the other thing is that my role is to do that. So I will tell you tonight, we had a student who was not in class. She was put in the waiting room because she wasn't on camera, and that's what we have to do. So it's just a different mindset, and you know, certainly send her an email. I see no harm in doing that. And she'll see it on the Zoom anyway. I mean, on the reports and stuff.
Gotcha. And then one more thing I needed your help with. So the responses, I can't seem to get them right. So like I add a new idea, I put a resource in, and I can't still seem to get like the full.
All right, let's look at, what are you talking about? Your last discussion?
Yeah, let's do like the last, like the last discussion. Yeah.
For the case study one?
Yes.
Yeah, okay. Let me just take a look and I'll pull it up for you. Yeah, because you guys did a beautiful job on writing, I think.
Yeah.
The group as a whole. Let me look. Yeah, so let me look at your responses, because the way we have to look at it is look at the whole discussion. So hold on a second. So remember, it's 2 points off. And so what I will tell you on your responses is there must have been something that was missing in them. So let me look and see what it was, and I can guide you that way.
It was like more detail.
All right, so here's your group one. All right, so let me share my screen with you and look at it. All right, so here is one of yours. Homeowners or the providers of health and topic of the material. Just 16. That one I would have given you credit on.
You wouldn't?
I would have. Yeah, that one looks good. I'm looking at this one. Responsive to special kinds of experiment. So in this one, what I'll tell you is it's a lot of opinion, kind of. You're like, I came across many jobs require more than just a GED, and many people are viewing a GED as a worthless piece of paper that do not do anything for them. My thought process is if you don't get a GED, you can't go on to college degree, as is a requirement for admission. So it's a lot of like, I liked your response, and this is why I would agree. So do you understand? So you want more of like this one. So what you did up here. Here you
So
gave a lot of data, you know, you weren't like, oh, I agree, and this is nice. And do you understand the difference?
Oh yeah, but like actually the GED part of like it not being accepted in more of a lot of, surprisingly, I didn't know that in a lot of workplaces was from that research from that thing. So at first I thought it was like,
Oh, it was? Okay, so
yeah,
the way I read it is sort of like it's more your opinion that you think like a GED. I know you say here that, and this is just research I came across. Well, on the other hand, and this is just research I came across on the topic. So it's sort of vague, but you say many jobs require. But if this is what you found here, then I would just cite it in your writing a little more. I actually am going to give you one extra point on that because this one was written very well. This one is a little too vague for me, but it's okay. But I'll give you full credit on this one for sure.
gotcha.
So let me just change that. And thank you for bringing that up to me. You have to understand, I read so many that sometimes they get blurry to me, not blurry in the sense if I don't understand them, but so I score you on your discussion and then I score you separately because I can't see in the grade book. So thank you for bringing that to my attention. I'm going to add a point to your score on that.
And if it's not too much to ask, I know you have so much to do, but like the professional development plan, is that?
Yeah, sure.
No,
Yeah, I'll
it
look
was-
at it. Go ahead.
No.
Which one?
No, it was the discussion one, sorry, it was the discussion one post, but like my initial post. So I got satisfactory on it. I actually thought it was very detailed. Like
Okay, well, let me look at it because I know when I usually know why I graded what I graded. So let me look at it, okay? It was the first discussion you said?
Yes, discussion one, the initial post.
All right, so in this one, I'll tell you right now why you didn't do well on it. I mean, you didn't get, because this information that you have pulled here is coming directly out of your sources, and I read your sources. So for example, signs and symptoms right here, and then when you do develop a 504 plan that helps them living by offering preferential treatment, where are you getting all this information from? Because if I go to Gavin 2023, I don't see any information about textbooks, audiovisual, behavior management, all that. Because I went to that website myself and checked it.
Really?
So I'm wondering where that came from. But anyway, so on your writing here, I don't feel like all of this is something that you're coming up with references for support. So I think a lot of this is coming directly out of that site. I'm not saying it's word for word, but you want to use some of your own mind too. So when you're doing educational plans, although you're not saying word for word, you want to come up with some stuff that's not coming right out of someone else's thinking. Because part of this whole thing was for you to come up with education that you could use. Now, when you come up with education, you could always reference it because you know that scoliosis, for example, they may need pain meds, right? So if you came up with some things that you know you've used in the past with other signs and symptoms that have evidence-based practice behind it, it has studies and stuff that shows it's effective, you could have written 6 things on that.
So it's not that, so the references are just to back up that, hey, what I'm saying is not out of the blue, not for me. That's where I got
No,
the.
and I will tell you, some of your classmates did not write this way. They came up with stuff on their own, which is what you really want to do in any writing, because it doesn't help to just take it off of other people's.
I thought it needed to be like facts, like this is like.
Well, it does, but for example, like I just said, if you were going to talk about pain management, there's several things you know from your med surge that they do for pain, right?
Yes.
You don't have to read something and say, well, I'm going to take exactly what this guy came up with for pain, right? You want to sort of expand your mind and think about, what would I do? Not what did this guy write about? What would I do if I were in that situation? And I think if I go down, it's probably the same along the way, because signs and symptoms look fine to me. But these kind of things, treatment includes, I don't even know what that word is, therapy. In this treatment, a medication given by mouth binds with lead, so it's excreted in the urine. That I know is right off the CDC website, because they talk about urine excretion.
And it's that therapy where they change, like it's like dialysis, but like for not really dialysis, but like they wash your blood.
Yeah. I mean, I mean, you know what I'm saying? Do research in the building you're going to move in, that's fine. Wash toys, you know, I just think you're like, for example, here, occupational asthma triggered by workplace irritants such as chemical fumes, gas, or dust. Allergy-induced asthma triggered by airborne symptoms such as pollen. I would bet if I pulled up your sources for your asthma, that's coming word for word off their site.
Definitely. I thought that, like, I'm sorry, that's what I messed up. I thought that it needed to be like, it's not up to what you think it is. So it's.
No, so here, look at and the only reason I go over this with you is just to help you a little bit. So when you're reading the assignments for this, it says right here, develop an educational plan that includes at least 6 points of education of parents and or children. So the word develop means what?
Makeup.
Yeah.
Gotcha. I thought it was like strictly research. Okay. No, that's awesome.
So, yep. So I hope that helps. And like I said, if you ever have questions when you're writing and you're not, you're confused or whatever, certainly give me a call, an email or a text or something. I'm happy to go over writing with you. I think what happens in this class is too, you guys haven't had a lot of experience of writing. You're using your knowledge and using research. So you're never going to just do all research and you're never going to do all knowledge, right? You got to have a mix of the two. So I think as you go through, you'll probably get better at that with your infectious disease and vulnerable populations as well. There's going to be things about primary, secondary, and tertiary that you've learned, and you learned it out of a textbook, but you're going to be able to come up with your own solutions.
Gotcha. Perfect. Thank you.
Okay. Yeah, sure. And certainly send that email if you'd like. You're going to get flagged because of your timing, but there's nothing, I have nothing to do with it. I just want to get
what was going on. That's all.
Yeah. Okay. All right. Take care of yourself.
Thank you.
Okay. Bye-bye.